Hi, I'm Elizabeth Tracy with CCTV, and I'm here with Dr. Joe Pepe from the Florida Department of Health to give us a COVID-19 update. So I'm going to let you go ahead and do your update that you do each week for us, and let us know what's going on, the latest news with COVID-19.
Sure, great, thanks for having me. As we've been monitoring the news, and what you've all been seeing is that the amount of COVID cases has continued to rise, not only in Florida and Charlotte County, but also throughout the United States. So I'd like to just share some insight as to what's going on. This will be kind of a U.S. Insight in Florida, then I'll take it locally so that we can just follow along. So the U.S. trend right now for COVID has been, we saw a peak back in April, and then it came down, and then as we started to reopen again, we saw more cases. Now the models are taking a couple of different paths. So right now, the projections still continue to stay relatively flat, but you see as we get closer to August, there's a projection for a slight uptake, and that has more to do with increased mobility, schools reopening, things like that. So the models are trying to get a better understanding as to what's happening there. For Florida, the same thing. We're testing, and we're seeing a projection as it continues to grow. A couple of things driving these projections are the schools reopening, as well as snowbirds returning back to our area. So as our population increases, it stands to reason that the number of cases would increase as well. So that's where these control measures are coming in place so that we can try and gain a better understanding and kind of flatten this curve and slow the spread. When we look at Florida again, as you see in the bottom slide, the social distancing model, we're using more information based on mobile technology and being able to track movement of people. And so you can see that the real dip on the bottom there was when we closed down and mobility was really at its minimal. Schools were closed, things like that. So as we started to reopen, you could see that the models are also projecting hospital resource utilization going up as well. But then you can see in August, there's that little step in the model, and that's really where what the models are saying is as schools reopen, as snowbirds come back and things like that, we're expecting to see kind of an increase in population, because we know that we receive a significant amount of people coming to Florida during wintertime. When we look at the overall state right now, the top slide in the top left is really the distribution by age as the number of cases. So we have fewer older adults being impacted by COVID. However, the white bar next to it shows the fatalities by age group. So you can see clearly that older adults are more at risk with COVID. And then so you see the bottom slide, the age with the most cases right now in Florida are 21-year-olds. And so the challenge that we have with this is we know 21-year-olds would typically do better because they have less other health issues. But the challenge is with multi-generational households and things like that, there's lots of grandparents that take care of children, as well as maybe even live with their children. So as a function of that, the 21-year-old or the younger adults that may be getting COVID are potentially exposing the older adults in their lives with COVID. So that's a risk factor that we're concerned about and trying to work through. On the Florida chart on the right, you can see that there are 12 COVID-dedicated nursing homes that are really done a great job in helping contain COVID, but also help offload the number of COVID cases from hospitals and other long-term care facilities and things like that. And one of them is right here in Port Charlotte. And so we're really proud of that. They've done a great job. And so we have a lot of regional assets to kind of help with the overall care model for COVID patients, whether they're recovering at home all the way up to hospitalization and long-term care. When we look at Charlotte County, the same thing, it follows along with the state. We were expecting and seeing a long, slow decline in the number of cases, but we are watching that. We can see as this long, slow decline in cases, we're seeing it flatten, and the model is showing a slight uptick again back in that August, September timeframe. So we're monitoring that and trying to put whatever we can put in place now to have our schools reopen safely and protect parents and things like that. So we're really using these models as more of a strategy conversation. So when we look at the data, and I apologize, this is from yesterday when I built the PowerPoint, but you can see clearly on the bottom the number of cases per day. There's been a significant uptick. And, but on top, when you look at the age distribution for Charlotte County, if I were to show you the PowerPoint from probably 2 months ago, the bar graph on the top looked like steps. They were basically starting out small and becoming larger as the age goes up. As you can see clearly, the 55 to 64 group is probably our highest group right now with infection rates. However, that number continues to come down. When I first started talking about this outbreak, we were median age somewhere around 71, and now we're at 59. So that continues to shift. So the other piece of this was, in the beginning of this outbreak, there was a significant amount of cases that were in long-term care facilities. So we had a very large amount of people over the age of 85 that were impacted, unfortunately, by COVID, which impacted our death rate. And so as our case numbers continue to rise and the distribution of COVID becomes more representative of our community population, all the statistics are starting to balance out and match that. So our percentage of deaths as a function of number of cases is continuing to come down. But what I am happy to report is that the rate of death recently has really come down dramatically, also because of the level of care that people are getting. They're getting into care earlier, and then our hospitals are doing an amazing job, and our long-term care facilities and primary care doctors are doing a great job in taking care of people when they get sick. When we look at our call trends, one of the things that we've been doing is the map, or the graph to the upper right corner, is really a heat map based on EMS calls for any COVID-related type calls, shortness of breath. Now, it could be asthmatic, it could be anything. But we map that so that we can see if there's potential hotspots related to COVID or any other activities, or we're using it also as a potential for monitoring if there was a mass gathering of some type, if we see an outbreak related to that. So it's just another lens in the way we monitor things to see what's happening in the community so that we can do protective measures for those areas. The nursing facilities have been remaining relatively stable. Several of them, as I mentioned before, have become COVID nursing facilities, so we don't expect the number of COVID cases to go to zero because they're specializing in caring for COVID people. But in general, the call trends and the overall utilization of nursing homes has been relatively stable, and they're able to care for those patients, not diverting and offloading to the hospitals, kind of surging the hospitals. We are seeing an uptick in surge to the hospitals. The number of persons under investigations and active testing at the hospitals has increased recently, and those are kind of early indicators for an uptick in additional cases. So we're continuing to watch that, one, to make sure that we have enough hospital infrastructure, but also making sure that we're ahead of the curve with supply resources and things like that, especially protective equipment. When we look at bed availability for the hospital, it kind of ties into what I just mentioned. You see the bed availability continues to decline, so the overall census of hospitals slightly uptick over the course of the last several weeks. So we're looking to see what our hospital plans are, how we can divert to other facilities. Hospitals have surge plans in place where they can utilize other areas of the hospital to create COVID wings and things like that. But the biggest component is we really want to flatten this out so that we can take care of those who need care and not overwhelm our hospital system like we saw in other parts of the world and even in New York when the outbreak first happened. So the test kits in the hospitals, they really responded well to more testing. They're also doing antibody testing so that if they get somebody in the hospital that may have had COVID or they suspect complications as a result of COVID, that they also are testing for the antibodies, and then we're counting those as cases. So for example, if they've never been tested positive for COVID, if they were actively sick, and then a month later the hospitals test them and they had antibodies, we will still count that as a COVID case even though they've technically recovered from the COVID phase. Because what we're seeing is also that, well, we want a more accurate representation of the number of cases, but COVID also has lingering effects. right? So depending on how it's impacted that person, there potentially could be other symptoms and things that come about from it, you know, lung damage potentially and cardiovascular issues and things like that. So the medical community is still trying to understand what the lasting effects of COVID exposure are. And that's another reason why we're pushing so hard for people to protect themselves. Sure, you might get sick and recover quickly, but there could be some lasting impacts that we don't know about. So we're really just trying to minimize that. When we look at the number of cases, it's been on a downward trend, but as you can see, week 26 is clearly more than week 25, and so we're monitoring what week 27 is going to look like. So we're clearly looking at this could be an upward trend, and we want to make sure we are prepared for that. Again, another way of looking at our nursing homes, you can see that they've been relatively flat, and as well as the number of staff members that are positive in nursing homes, the orange bars are going down. So that's a good thing, so that we're doing a good job at creating safe environments and protecting our nursing home staff to care for those individuals. Same with assisted living facilities. We monitor and we test every other week, pretty much, all of the staff and residents in all of these facilities. So we have a pretty good surveillance as to what's happening there. So we're really pleased as to where they've adapted and done a great job. When we look at the total number of cases, I shared a lot of this information already, but the hospital data, and this was from a day or two ago, so it's not the most current, but we only had one person on a ventilator at that time that was on COVID. Much of our intensive care cases right now have been cardiac patients. And so when you hear a lot of times the ICUs are full, a lot of them have to do with more cardiac patients than they are actually COVID. However, we're monitoring that very, very closely, just because if we see an uptick, we need to make sure that we have the ability to handle that surge. And same thing with long-term care facilities. We have 8 facilities that have designated wings. We've had 13 facilities that have been impacted, so we're monitoring that. And so the nursing homes play a major role in the overall system, because as you can imagine, if a nursing home becomes overwhelmed and they start to discharge to a hospital, then the hospitals can easily become overwhelmed for any new patients coming in. So it's kind of an ebb and flow, because the hospitals need the nursing homes as well to discharge patients to, so they can free up beds for new cases. So it's a symphony, I guess, if you will, a quilt of services that are working together with each other. So when we look at our testing, we're testing again today at the sports park, and we're over 14,000 tests right now in our community, and our goal is to test at least 2% of the overall population in Charlotte County every month. So I think we're exceeding that, we're doing well, but you can see clearly in the yellow line that there's been a significant uptick in new cases over the last few weeks. So there's definitely a curve change for us, and that's why we do the testing. It's to maintain a surveillance, just to gain a good understanding as to where the cases might be hiding out in the community. Overall, our positivity rate from last week is 10%, a little over 10%. For the entire outbreak, it's been about 6 to 7%. So we're watching that to make sure that we're slowing the spread, and the goal is to keep everything under 10%.
But what does that number mean, though, that 10%? So is there an increase if that's the
Right, so the
positivity?
positivity is our testing metric. So it's kind of a statistic that some people misunderstand, and so it's a great question. We use that as, are we testing in the right places? It's not necessarily an indication that 10% of the entire Charlotte County population is positive for COVID. When we do surveillance for other things like hepatitis, HIV, things like that, when we see very low positivity rates, what that says to us is that we're not testing in the right areas to capture potentially the cases, because we want to know where these viruses are hiding out. And so same thing for COVID. If we're testing and we see a 1% positivity rate, we'll move the site around just to gain a better understanding of testing in those higher risk communities, so that we know that we're capturing the cases that we might be missing. And so it's really kind of a statistical analysis that we know if we do enough, not so much random testing, but enough broad testing throughout the community, we'll gain a better understanding of realistically what the potential actual levels are. We know that some people who may get sick may never seek care at all. right? They might just get better at home, never get tested, and so if we test enough people statistically, we can kind of estimate what an actual infection rate would be. So treatment has evolved dramatically. When we first started, it was all conversation about hydrochloroquine and ventilator utilization. And as we evolved, through lessons learned not only through Italy and Europe, but also New York and elsewhere, that we were seeing that there were other techniques other than ventilators in order to help people recover better. Ventilators on their own are inherently potentially damaging. There's some risks associated with being on a ventilator. And so the physicians have really discovered by positioning people and going to a higher flow oxygen, they've been able to get oxygen levels up, and the patient does great. So it was just a different strategy. And it also preserves ventilators for those who need them. So that's a good thing as well. The other was the FDA really pulled back the use of the hydroxychloroquine to more of a recommended remdesivir for those that are hospitalized. And remdesivir is an antiviral. That the best way I can describe it is that it keeps the virus from replicating so that your body has enough time to fight it off. And so that's been very helpful, and the physicians are telling me that they see really good results with folks on that therapy. Then there's some other things where the doctors are really looking at treating the patient, not the monitor, right? So we're seeing cases where, although the person might be doing well, not on a ventilator, they're having all types of other complications as a function of inflammation, or COVID has had some really interesting effects with blood clotting and things like that. So their use of steroids and anticoagulation therapy and different things like that, just to prevent the symptoms and side effects that the patient is dealing with because they're doing well with the respiratory side of things. So that's where you're seeing more steroid use and some other things happening. So where we've been helping is really ensuring that there's been a good supply chain of remdesivir and other things, pushing out the reagents and things like that for labs so that more and more hospitals and other facilities can get better at testing, so that offloads the need for mass testing and things like that. And then really providing personnel. We've added a lot of people to the health department just for contact tracing and nurses to help with testing, all that kind of stuff. But really to help protect our hospital infrastructure, our medical infrastructure, our responders, just to keep everything working so that as this outbreak continues, we're able to handle that. And I hate talking about it, but we're also in hurricane season. So making sure our infrastructure is strong and not overwhelmed, so in the event that we have to deal with a hurricane, that we're in the best position possible, be able to handle all of that medical surge. So there's a lot happening right now, but a lot of activity with personnel as well and training.
How does that go with the contact tracing? Talk a little bit about that.
So yeah, the contact tracing, we have, the best way I can describe our contact tracers is they're our detectives. So it's no different than you would think about as a detective in police work. So when we get all of the labs report to us electronically what the test results, positive or negative. And then when they're positive, we get alerts so that our contact tracers and our epi team start to pull all that information together, and then we do outbound calls. And so we will call the person, and then if they're not available or unable to talk, let's say they're hospitalized, then we talk to their caregiver, physicians, things like that, to gain an understanding of when symptoms started, were they working, were they home, were they travel related, and try and determine if there's linkage between other cases, right? And that's what we call it epi-linking. So it's epidemiologically linked. So for example, let's say you had a wedding, and those people may be positive, but they may not know each other. But yet in our surveillance system, we put in there, that they were associated with potentially going to an event. And then we're able to start putting together a bigger picture to say, okay, we've had 6 people from this event that have all stated they went to this event. So we're starting to see some parallels here. And Charlotte County, we did that early on with the, I don't know if you remember, with the Nile River alert that went out early on in the outbreak, because when we started to see cases, we started to see association with travel to this region. And across the state, because we're an integrated health system, our other epidemiologists all started to see the same thing, and we have a database where we sort of put communications in there saying, hey, look out for cases potentially from this area. And then when we started to see a critical mass, that's when we put out a public notice and saying anyone who's gone to this area during this time frame, please, get tested, that kind of thing. So that's sort of how it all works, and it's really interesting and exciting and hard. It's very detailed work because sometimes we can't reach that person, and so we have to try and figure out how to put all that together. And so that's why there are detectives. They really paint that whole picture. And then the other part too is notifying all the potential people that could have been exposed and put in protective measures there. So they may not be sick, but we may ask them to isolate. They were low risk exposure, so we may ask them to monitor their symptoms. Most recently we've had with a daycare. So we provided guidance on how to protect the little ones and their families, and infection control for the daycare, things like that. So we're really working behind the scenes to try and mitigate the spread and all of those things. And then the biggest piece is just a lot of education. We have an education team that's out there all the time, and we try to simplify the messaging as much as possible just so people really understand what it is they need to be concerned about, how do they protect themselves, and then at the end of the day, what to do should I become sick. And so that's kind of what we've really been focusing on to help people to help themselves. And so the closed spaces messaging, crowded places, and close contact, that's really trying to summarize it and keep it very simple. And a lot of times people aren't really sure what's a low risk versus a high risk environment, so we try to describe that based on what we're seeing from our epidemiologists and our teams. And what we're seeing is folks that are in enclosed, crowded spaces with poor ventilation really is kind of so some parallels with that. So you may have seen that in a restaurant or a bar, but we've also seen it in work environments. We've had some farm labor workers that live in close resident housing that we've had significant outbreaks across the state in. So we just try to describe what a high-risk environment would look like so that people understand more when it's appropriate to wear a mask, or when can I take the mask off my face and relax, that kind of thing. So we're really just trying to educate as much as possible, but that's a big part of it.
So what were the 3 C's again?
Closed spaces, crowded places, and close contact settings.
Okay.
So the highlights right now are really that we've seen a significant increase in younger adults. We're testing all over the county. We have multiple test sites, and we're continuing to help physicians be able to test their own patients so that people will not have to go to these mass testing sites. We're relocating back to the sports park just because we want to be able to enhance up our testing capability and capacity. The average age is kind of coming down younger. As I mentioned earlier, that our physicians are doing a really good job, and so mortality rates are declining. We're good with our supplies and resources in the region, but really the biggest message through this entire conversation is we really can't do this without the help of the community. And I know wearing masks is a really contentious topic, and I'm not interested in making this a political conversation. We know that masks are better than no masks, right? And so anything, whatever it is in small way that we can help each other is really what we need. And so it's no different than how we come together after a hurricane or any other event that we have to deal with as a community. If we can all help each other in just that small little way, it'll make a big difference in slowing the spread. And that's really the big message in this whole thing. So that's pretty much it for my comments, unless you have any questions? Or?
No, I think it's just the 3 C's, the importance of understanding the best way for us to protect ourselves, which is with the mask and avoiding closed spaces, crowded places, and what was the third one?
Close contact.
Close contact. Yeah. So just protecting ourselves and each other.
So let's talk about masks for a second, because I think there's a lot of misinformation on masks. So you and I are wearing cloth masks. We know that cloth masks are not perfect, right? But I also know that I was tested recently as well, so I know I don't have COVID. But for whatever reason, Let's say I have COVID and I don't know it. The mask isn't going to be ideal, the cloth mask, or even the procedure mask, the paper ones, or the buffs that people are wearing. However, it does slow the spread. So if I cough, rather than having no mask, it could travel further. Then if I'm wearing the mask, maybe it just goes a foot or kind of stays. So it's just a way to help. It's not perfect. The N95s that you see that are the respirators, if they're fit properly, they work very well in preventing spread. And that's why medical providers, physicians, EMT workers, folks like that use them, because they're really up close to the patient. They're interviewing actual patients with COVID, and they're coughing and doing aerosolizing procedures and things like that. So it's very important that they filter the air that they breathe. And so the mask piece isn't perfect, but it's just another layer. So if I can minimize my footprint in the community, then if more and more people do that, it just really helps. And so we've seen cases where potential exposures have happened, and one of the first questions we ask is, were they wearing a mask? Were you separating and things like that? And if they were both wearing masks and they were kind of separating and it was outdoors, then it's a low risk exposure compared to if you or and I were in a car together for an hour with not wearing a mask, then that could potentially be a high exposure, right? So that's the kind of stuff that we're trying to educate people on. It's not really so much that we're trying to force anybody for anything, because we recognize that masks are uncomfortable. People have concerns about oxygen levels and things like that. And what we're saying is, if you're able to wear a mask, if you can please do that, that would be great. If you're not able to for health reasons or for whatever reason, just try and maintain your social distancing and help each other. That's all. We're not trying to force anybody into anything. It's really more of a, how can we help each other? And so I hope that's helpful to the conversation. I hope this presentation is helpful, because we're going to be dealing with COVID for quite some time until we get a significant medical intervention like a vaccine. And so I think if we can just help each other and kind of work together, I think
that was my next question, is this is a marathon, not a sprint.
Yes.
And what do you see for the future?
Yeah, so for the future, what we're looking at is obviously slowing the spread, control measures, working through school districts reopening as well as colleges reopening and snowbirds and all that other stuff happening. But really it's maintaining and flattening the curve long enough in order to support potential medical interventions like a vaccine or something like that. So there are lots of companies that are in production in multiple phase trials on vaccines, and some have been very promising. So we're trying to get a better understanding as to the timeline of what that would look like, so that we can make sure that we're prepared and positioned to help vaccinate our community when that becomes available. Realistically, they're saying potentially first quarter next year, but this timeline has been changing dramatically. So we'll see what happens. I hope sooner than later, but we definitely want to do it safely as well.
We have questions coming in online on our Facebook talking about masks with students.
Yep. So there's been lots of conversation with masks with students with the school district, as well as the pediatric masks for little kiddos. And so first of all, having children, I fully recognize having a child wear a mask is extremely difficult. So that's probably the hardest part is, and then you want to do it safely, right? You don't want to put a mask on a little child that potentially could be risky. But the schools have talked about wearing masks during class transitions and things like that. If you think that your child could wear a mask safely, that's great. A lot of the challenges that we've had right now is the pediatric masks aren't really available. So it's really hard to get a mask that really fits the child well. It'll fall off because it's too big, that kind of thing. But I think what kids have had a lot of fun with is the buffs. What
is a buff?
They're usually made of silk or cotton.
Okay, they go around your neck.
Yeah, they go around your neck and you can kind of pull it up over your face. You see a lot of landscaping people use it, or when you're outside fishing, things like that. And we've seen kids have a lot of fun with that and tie-dyeing them and making them kind of creative and things like that for their schools. But, I think the biggest concern of any parent is how do you keep your kids safe. And so I think in that conversation, wearing of the mask is just one layer in the big picture. I think the biggest message for parents is, especially when schools start, is if you think you're sick or your child is sick, please keep them home. Don't send them to school. And I know that's not easy because we have to go to work and all that other stuff, but if we can prevent an outbreak in a school, that would be really great.
It's the Board of Charlotte County Commissioners has recommended people wear masks, and like you said, it's really just do it for the community and to help protect others in case you are positive for it. Well, thank you, Dr. Pepe. This has been informative. I know you go out into the community. Where can people go to get all of this information for themselves?
Gosh, so we have presentations regularly at the county commission meetings, so they can tune in to CCTV and watch that. We have our Florida Department of Health Charlotte County webpage. We have the State of Florida webpage, and I would say the CDC webpage on COVID is probably the best places to go to.
All right, very good. Well, thank you for tuning in and for coming out and giving this presentation. For CCTV, I'm Elizabeth Tracy.